Hey everyone, it's Melissa. Today is, Friday, December 27th, 2024. Hope everyone had a great holiday. If you celebrate Christmas, I hope you had a wonderful Christmas. I am making this video because some people had asked me about the bariatric side of my journey. So for those that are new and this is your first time watching, I'm Melissa, and pardon my little baby hairs over here that just are doing whatever they want to do today. So I am a bariatric patient. I had great success with my vertical sleeve and lost a great deal of weight. I'll go into that in a minute. The weight came back due to pregnancy and food behaviors and stuff I'll talk a little bit more about. Gained a lot of weight back, not the full weight from the surgery. And now I'm on a GLP-1. I am on compounded tirzepatide, known as Zepbound, Mounjaro. I'm going through a compound telehealth pharmacy, Mochi, which has been really amazing and wonderful, and I'm really glad that I found them. So I've been on my GLP-1 journey since February of this year, 2024, and I'm down about 56 pounds. So kind of catching you up a little bit, and there's other videos that you can go back and watch. I'm going to try to not play with this the whole time on my video, and maybe my bobby pin will kind of smooth it down. Sorry. So talking about the bariatric side, so going back to when I was getting ready to have the surgery, I was 403 pounds. It was a lot. Okay, sorry. So I decided at 403 pounds that something had to give. I was miserable. It was very hard to walk. It was hard to breathe. I looked and felt just miserable. Sorry, it's going to bother me again. So I consulted with a bariatric special place in Kentucky. So they were a special bariatric facility. I went in immediately. I felt like, oh my gosh, this is a great facility because they had chairs I could sit in, and I'm not worried about it breaking. I'm not worried about it falling or anything like that. So immediately, you know, you feel like you're at home because there is a comfortability, right? I saw the doctor, we talked. This was in 2013, so we're talking 11 years ago. I had already made up my mind that I wanted to do the vertical sleeve. So if anyone is unaware of what that is, it's where they remove 75% of your stomach. You're basically left with a small banana sized stomach. So there's no rerouting of intestines like the bypass. It's not the lap band at all. This is a actual, rough surgery. So I went through, you had to do some evaluation, a psych evaluation. You had to talk to, I think, the therapist a couple of times. And for me, they did have a course on nutrition. You talk to a nutritionist, but it wasn't, at the time, I thought that's what I needed. Looking back now, it's not everything that I needed to succeed. So I had the surgery. I did end up having a really hard time coming out of the surgery. My blood pressure went through the roof, which had really never been an issue. And they had to keep me in the hospital to get it down. Coming out of recovery, a horrible gas pain. So if you are thinking about the surgery, when you come home, do everything that they tell you to do regarding the gas, because it is miserable and it hurts really bad. I remember feeling the pressure right here, from here up, and you had to keep on I had a wet, warm compress with a heating pad on top of it because it was pretty severe. So in a period of a year, starting at the 403, I got down to 242 pounds. I had lost 161 pounds, which is amazing. I felt great. I looked really good. I was going to the gym. I was doing some of the weight machines, not knowing the different things that I should be doing, I guess, weight-wise and strength training. So then I ended up getting in vitro. And with the fertility drugs, I think I gained about 20 pounds. And with my pregnancy, I gained about another 30. So I was back up to 300. And over time, I got to 330. And that's where I said enough is enough. And that's when I started the GLP-1 this year. So going back to the bariatric, I definitely think there are some things that need to be said, and hopefully they are implementing now. And I don't know the process now. I can only speak to my experience from 11 years ago. However, I will say that something that needs to be done is when you have the bariatric surgery, and in the beginning too, I think when you're prepping for it, but probably after you have it, because you're in a more focused mindset, I hope, is kind of working on your behaviors and your mindset around food. And that's something that they didn't teach us when we were taking these required classes or speaking to a nutritionist. And I really think that that really would have been a huge help. So what I will say, people say, and I think they even say in the from the doctors, that having the bariatric surgery is supposed to remove your ghrelin, your hunger hormone. For me, that was not the case. I started feeling hungry again. The food noise was the biggest thing. The food noise never went away for me. And until I got on the GLP-1, I thought food noise was a thing that everybody had. I thought it was just normal. And I thought, why am I feeling this way? What is wrong with me? Why can't I stop thinking about food, when I'm going to eat, what I'm going to eat, how much I can eat, what I can squirrel away for later, all the different things. And it was an addiction. And that is the first thing that really should be talked about with a bariatric surgery. If you're going to be cut open, you need to work around your mindset with food, how you are with food, why you are that way with food. Is it because of a trauma? Because mine was. I feel like because of the trauma in my past, I apparently just unconsciously didn't even realize I did it until I started talking to a therapist. I ate myself fat so I could stay invisible. I did not want attention from the male species. I wanted to be invisible. And being fat, you're not really invisible per se, but people aren't going to be looking for you as a person that's attractive. So that for me was very revealing, that that I felt that way. And I think that that was a big thing. Another big thing for me was I was always taught, you clean your plate. And I think everybody was feeling that way or taught that way. You have to clean your plate. You're wasting food. Oh, there's starving kids, in another country. We were all told some kind of story like that. Okay, sorry everyone, had a grocery delivery. So going back to the different things that I wish that we would have been told or helped with on our bariatric journey is, like I said, working on the food behaviors. You really want to be honest with yourself and really dig deep. And for me, that didn't really come until I sought out a really good therapist. She was just going to help me overall with anxiety, loss of someone very close to me, stress, some different things like that. And as we talk, she questions and digs deeper, and that led into more self-reflection. And in one conversation, it just was like a light bulb, and it hit me of why I think I had a lot of problems with overeating. And you want someone that's going to help you do that, but in turn, you, like I said, you really have to be honest with yourself. Because if you're not honest with yourself and you're not honest with your therapist, you're not going to get to the problem at hand, and you're not going to be able to fix it. And if you're not going to fix it and not going to be honest with yourself, then you shouldn't do the surgery. And you need to think about something else because you're not ready. So that is the biggest thing I would say to anyone, is working on your behavior and mindset around food. You also need to start looking at food differently. You know, there's a lot of different things out there that you can look as resources. There's food freedom classes. There are behaviors and mindsets about overeating, binge eating, you know, different things like that. There's cognitive behavioral therapy that you can look into as well. But anything to work on those behaviors and reframe food, because food is not pleasure. And I think for the longest time, we've all just ate what we want and not thought of the consequences, and that food at the moment just tastes really good to you, right? And it's satisfying something in your body that you apparently need. Sorry, my dog is going to have the zoomies. Abby, what are you doing? So, be honest. You know, if it's about grief, if it's about a loss, talk through that loss with someone. Look into resources and journal if you need to, and be honest in that journal entry. Nobody has to see that journal but you, if that's what you want, about why you feel like you overeat. Why do you feel like you have gotten as big as you have? We have different things, right? We also have society that adds different things into our food that makes us want it more, and we become addicted to it, and we just crave it. But we need to take a step back and realize that food is an item. It's a thing. It's there. It's not something to soothe me. It's to give me energy. And the right food makes a difference. If I'm going to fuel my body with endless crap and junk and carbs and sugar, I'm going to feel like garbage. And I'm tired of feeling like garbage. And that's what I told myself. I'm tired of feeling like that. So be honest. Journal. Get yourself a private journal. Carry it with you. Make it a thought journal. I had one, and I still do. And I carry it with me. A lot of times it's in the car too. So if I have something, something that pops in my head, I want to write it down. And it doesn't matter what it is. And if it's, you know, it's honest as can be. And that is a journal between yourself and you alone. And that's it. Be honest about why you're grabbing that cupcake. Be honest about why you went and snuck 5 cookies over there. And now you're going to have something else. And you're pretending that you didn't just eat those 5 cookies. So the biggest thing with that bariatric surgery that I don't think is being taught, like I said, and I could be wrong, and I hope I am, is working on the mindset, because the mindset is the number one thing that will get you through your bariatric journey. Mindset is what will help you succeed and keep it off. So another thing I recommend when you have your bariatric surgery is that you start changing your visual behaviors. And what I mean by that is go from, if you look at plates now, a lot of plates are 10 inches or more. And that's ridiculous, right? And that's how it tricks our mind that plate has to be full. right? If it's not, then we're not eating enough and we're not eating right. Go down to an 8-inch plate like we have had for so many years before everything got supersized. Start with the 8-inch plate. It tricks your mind in a way and gets you to remember, this plate is my plate. And oh, okay, I filled up my plate. That is plenty of food on an 8-inch plate. If you start making that change, that will also help. But when you've had the bariatric surgery, you're going to tell you're not going to be able to eat a whole lot. But if you start getting that hunger hormone and everything else, and you're still using a same 10-inch plate and you're loading it full of crap, you got to take a step back and start smaller. So grab an 8-inch plate. Sometimes I even go for the salad plate, which is a little bit smaller. I think it's like 5 or something. I'm not sure what it is. Especially if I'm at a party or something. And I will put stuff on it. And I'm like, okay, and that's my plate. You also have to remind yourself that you will not be able to eat as much as you think you can. After bariatric surgery, your mind still thinks you are that huge person. And it's going to tell you to fill it all, your plate, fill your cup up with all kinds of crap. You know, you're just going to eat a bunch of crap. Or just a bunch of veggies or whatever you're having. I can eat that whole chicken, piece that's on my plate. No, you can't. And you're going to start feeling it. Something that I noticed right away is when you take a drink and it still works for me even now, 11 years later. I feel it go down my GI tract until it hits my stomach. Same thing with my medicine. If I take my medicine, I feel it, and I feel it come down and go all the way down and hit my stomach. Sometimes I feel it get stuck, like right here. And you need to take another drink to push it down. It's not fun. I'm trying to think of some other things. It's weird because you do feel the food track, like coming down your track as well. And one thing I noticed is I would go somewhere and I would have a couple bites of food, but something would get stuck. And I either wasn't chewing it good enough, or I felt my head told me I was so hungry that I had to hurry up and get that food in my body to get that hunger hormone to stop. And then you would feel this clogged up feeling and you would go, oh God, oh. And slowly it comes back and it sits there and it comes out. It is not good. I think in an episode I did about bariatric surgery and GLP-1s with the team, The Downsized, Christopher and Lorraine Durham, me and several other wonderful ladies talked about what's called dumping syndrome. And Barb, the one that had the gastric bypass where they rerouted everything, actually had the dumping syndrome. I had it as well. And I would eat something and sometimes it did not sit right, or I had one bite too much and I either missed that signal that no more should go in, or I ate too fast and then I'm like, uh-oh. And I would have to throw it up. And once I threw it up, I was fine. So just be aware of that. I know it's really hard when you're really hungry to not want to hurry up and eat as much as you can just to satisfy that hunger hormone. And it's a learning curve. So I would say wherever you go, take some Kroger bags with you for a while until you learn, because it is a different feeling for your body and it is a learning curve, because you're going to learn a lot of different things on how your body feels and how it likes things or it doesn't like things. So just try to be prepared. If you feel a nudge in your body, in your eating, just wait. Give it like 2 minutes. Play on your phone for a minute, whatever you got to do, take a few breaths and wait, because chances are that's that signal that's telling you, no, we're done. Don't put any more in. and it doesn't take much, and your brain is still thinking, oh, I'm not satisfied yet. You know, I've only ate like 10 bites of this. No, you gotta wait. So I also want to say the first year, and I don't know how this is now, but the first year my bariatric surgeon had us on different vitamins, and we had to stay on those vitamins the entire year. So don't skip your vitamins. It is very crucial, especially that first year when you are going through this. You do lose some different nutrients and vitamins, and you're not going to be able to get them in the way that you want them to. So take the vitamins. They are very important because you do not want your organs shutting down on you. One of the other things I will say that I realized after having the surgery, and I didn't know that it was a thing, which reminds me to take a drink. Dehydration. After you have bariatric surgery, you'll realize you cannot drink as much as you want. You can't chug it. You can't gulp it. I'm feeling mine go down right now. You also, if you take a big drink, it's gonna hurt and you're gonna feel it. And you're gonna get reminded, don't do that again. Because that pain is unbearable. Usually you take an extra sip too much, it sits about right here. And it just feels like this stabbing pain. It's not pleasant, and I don't recommend it for anybody. It is painful, and unfortunately I think everybody has it once or twice at least until they know what's going on. So try to drink a little slow. I still don't sometimes, and I forget, and I'm like, oh God, yeah, I gotta stop. But dehydration is a big thing. You're not drinking as much anymore. You don't realize it either. So be cautious of that. I get lab work a lot, and it shows I'm dehydrated, and I'm like, yeah, I'm trying. It's not, even though my drink is near me, I have one right here. It's not like important in my mind, and I would say try to do something to make that in the forefront of your mind constantly. Take it with you. It's an attachment to your body to sip and sip and sip and sip. So what I've done 11 years out, me being on a GLP-1 too, I'm not eating that much, but also trying to help with the dehydration. I've been getting the Element electrolyte drinks. This one is a carbonated sparkling water with, this one's grapefruit, but they do also have packets. So something that is legitimate, and I say legitimate because there's a lot of them out there that claim that they're going to hydrate you, and it's just a bunch of bull. So check the ingredients, check the, the credibility. I like this one just because it does have 1,000 milligrams of sodium. It has 200 milligrams of potassium and 60 milligrams of magnesium. So it is helping to replenish things. I notice if I get a headache or I feel very tired and worn down, I'm like, did I drink today? I'm like, oh my God, I've not even had like a full McDonald's cup of unsweet tea. And I'm like, and it's 6 o'clock in the evening. So I try to grab one of these, and I'm like, hopefully that'll help a little bit. And usually it does. It helps with headaches. It just helps me to feel better. So make sure you're getting something, whether it's liquid IV. There's some other ones out there too. Whatever you like, try a few out. I wouldn't buy a whole box until you're certain that you really like it. And that's the other thing with bariatric surgery. I feel like my taste did change a little bit, and I wasn't able to drink carbonated beverages for a few years. And I know they say carbonated beverages going forward are a big no-no. I don't have any problems with them anymore. But I would say just just be careful. For the first year or two, don't drink any carbonated beverages. Do what they're asking you to do and follow that, but also work on the other things that I was mentioning. So dehydration, always be mindful of that dehydration because it will get you. And sometimes you don't realize that you're dehydrated. I talked about the hunger cues never going away, the food noise. So I think that's why I also turned to the GLP-1. You know, I still had that hunger. I wanted to eat and eat. Never felt satisfied. I still had that constant food noise in my head and was just still obsessed with food. And I did hear, I think it was on the podcast that I was on, that some bariatric places now are helping supplement with a GLP-1 with a bariatric patient. And that may set a whole new success rate for that, because if that's the case, I think it'll be a lot more effective. With a GLP-1, the food noise for me has been completely gone, and I've been able to actually think. I feel like my brain has been quieted. I feel like I've been in a stadium, like maybe a football stadium, and the crowd has been, you know, chanting and blaring, and now it's gone. So I've been able to focus on my food behaviors that I didn't get to focus on before, and why I eat this, why I eat that, and being honest with myself about those things. And now I'm very impartial to food. Food doesn't have a meaning to me anymore like it used to. Sometimes with food now, it's I look at it and it's not appealing, it's not appetizing, it's not it's just there, you know. It's just like, I don't want it. So I do think if they are using GLP-1s with bariatric surgery, I think that the success rate will be a lot higher. You do follow up with your doctors and physicians from the bariatric surgery, usually for the first year. And I highly recommend that you attend all of those classes. If you do think about food constantly, I didn't realize that that's what I was doing at the time. I would suggest you really talk to the nutritionist and anybody else that you're working with on your bariatric journey. The other thing I really think would help is work on your self-esteem. I think a lot of times being an overweight person, it's weighed on us for so many years, and mentally it has taken a toll. We've been thought that we were pregnant from other people. We've been told, you know, how fat and disgusting we are. People assume that we're lazy because we're overweight. There's so many stigmas around being overweight. And unless you're overweight, people don't understand it, right? It takes a toll on yourself. The thing to remember, and I usually say it at the end of all my videos, is you need to take care of yourself because you're worth it. And you are, and that's why you're doing this for yourself. You're getting on a journey to be a healthier person and be the best version of yourself that you can be. And you deserve it. So put in all the work and the effort now and do it while you have the support around you. Work on your self-esteem. Like I said, journal, be honest. Talk to a therapist if you can. Make sure, like I said, that they're a good therapist. I highly recommend those. There's nothing wrong with talking to someone about those things. I think, again, there's a stigma against mental illness or mental challenges, that we're not allowed to talk about those things. And I just feel like that's not true. It's not shameful to need help. It's not shameful to need support, because some people don't have support. Some people aren't educated enough to provide that support and guidance. So I think those are the biggest tips that I would give for bariatric, not including any GLP-1s. If I think of more, I will definitely make another video. But if you have questions about the bariatric perspective, please let me know in the comments, and I will be happy to address those and answer those as best I can. But I hope that this was helpful for you, and please stay tuned because I have a lot more great videos coming. And if you have something you'd like to know more about, let me know and I'll see what I can do. I hope you have a great day and Happy New Year.